Okay, for today's discussion, I have one topic that is fixed partial dentures, the prosthetic part of it, crown and bridges. Okay, so after RCTs or for aesthetic purpose, we do the crown preparation. So now I will be telling you what are all the available materials for crowns and bridges available. Okay, so first I'll be talking about the most widely used and the most aesthetic lifelike material, that is all ceramics. Okay, so under all ceramics I will be considering from Ivoclar range. So first we have the lithium disilicate glass ceramic, second we have zirconium oxide, and third we have fluorapatite glass ceramic. So lithium disilicate glass ceramic can be used for single crown like this. Okay, it has no metal, it is all ceramic material. Okay, there is no metal used, and it is used for single tooth. It can be used for implant abutment kind of a thing, it can be used for that as well. Second is zirconium oxide. This is the most efficient. As you can see, this bridge is made of zirconium oxide, Ivoclar CAD-CAM. Okay, so advantage, it has its strength, it is very high strength, it is most efficient, it has got a lot of shade options, very lifelike, and it can hold up to a lot of compressive strength, so very strong. It can be used for long span bridges as well, and can be used for anterior, posterior, anywhere. So this one is pretty strong, so can be considered for a lot of cases. The third we have fluorapatite glass ceram. So this one is only for veneers or very aesthetic concerning places. It can also be used along with, like on zirconium we can layer it because it has that capability, it has got various shades, so that ways. And our lithium disilicate can also be used for inlays, onlays, all these purposes, but the most widely used is zirconium oxide because of its strength, and because second. Okay, so second option that I have is porcelain fused to metal crowns and bridges. So this is a bridge, this is a 4-unit bridge, as you can see. So it has a metal coping, as you can see it has a metal coping, okay, on which a thin layer of porcelain is given so that it looks lifelike, it looks like a tooth, and it's not gray or something that bothers you when you open your mouth to talk. So this is very strong, it's very strong. It can be made conventionally, or CAD-CAM preparation can also be done for these porcelain fused to metal bridges. It is very widely used, it is very cost effective, and this is also very aesthetic because the porcelain has a lot of shades, and when made properly it mimics your tooth naturally, so it is quite nice. It can be full covering porcelain or half, or depending on the requirement of the patient. It has got many advantages, but a few disadvantages as well, because it cannot be used on very short crowns, and if the vertical distance is so decreased, because it requires a lot of preparation on the occlusal surface, and it cannot be given when there is very reduced vertical height, and for very short crowns also it cannot be given for that case. Then if people have some allergy to some metal component or nickel allergy, they can also it will not be preferable for them. It's contraindicated in those cases. Then it leaves a little grayish hue on the cervical third that can be seen with these, which is seen with all metal restorations that we do. Either it is amalgam or we are giving any crown. So if it is metal, it is going to leach some of the tarnish and corrosion products that is there. Okay, so my third option is metal alloy. Okay, this is full metal. So as you can see, it has got great strength. Preparation is also very minimal for this. It has got good retention, and but it is not aesthetic at all. People don't like to use it on their anterior teeth, and it is good because when there is very little space, we can always go for this one, the metal alloy. Okay, so there are three kinds of metal alloys that you can use. First is the high noble metal alloys that contain 60% noble metal and 40% gold. So there are three varieties. For example, I have written, one is gold, platinum, palladium, second is gold, palladium, and third is gold, silver, and palladium. Okay, these are the high noble metal alloys, the first category. Second is the noble metal alloys that contains 25% noble metal. Example, we have like silver, palladium, and there's no gold in it. And the third, which is the most commonly used, is the base metal alloys, that is nickel, chromium, and cobalt chromium, or the titanium ones. Okay, so these are the most commonly used, like titanium ones and nickel chromium and cobalt chromium. These alloys are your MRI safe as well, so you can go for these in very compromised cases, like as they are very cheap, because of their aesthetics they are cheap, so one can go for these ones. And so hope you liked my presentation on these fixed partial dentures and their kinds that we give. I'll also show you